Can you hear the?
Hi, everyone. Welcome to another question and answer session with Dr. Drossman and myself. Today, we're going to do something a little fun and different. We're showcasing one of our patient vignette videos that we've created as part of our communication training series. So we hope you enjoy it and learn a little something today. Dr. Drossman, how are you?
Doing okay. Looking forward to this.
Yeah.
I'm going to share the screen and give you the background of what we're doing. And so, as you know, we've been producing training videos to teach communication skills to optimize the patient-doctor relationship. And so we have 3 video series. The first one, which we call Communication 101, are basic information for physicians on how to prescribe medication, how to make a referral, and it's done by our experts. Many of them are on our Rome Foundation Board of Directors. The second one is a step up. It's a more intermediate program. We call it Communication 101.5. And you've seen some of these. We've played several of these, where someone comes to you as a physician with a problem like they want opioids, or they don't want to go on a neuromodulator, or they don't want to see a psychologist. And so this one teaches you a higher level of communication where you pick up the challenges and find ways to overcome them. Now, 202 is our most advanced program where where you're looking for the meaning behind the presentation. Why is this happening? Why does this patient have those symptoms? And so what we do here is we do 2 videos. One of them is an ineffective interview, and then we'll talk about what's wrong with this. And then we'll go to an effective interview where so much more information comes out. And we're going to dissect that out. And you're going to be the student to observe this and tell us what's right and what's wrong as a way to understand the meaning.
Perfect. Let's get started.
Okay. So here's the video. It's going to start with a case report. This is case vignette number 6. A 64-year-old male executive vice president of a large marketing research firm has a 6-month history of epigastric pain that is limiting work activities. He prides himself on his good health and successful career. He exercises regularly and keeps a very busy, at times hectic, work and travel schedule. He describes the pain as burning, worse with eating, and only partially relieved by antacids, H2 blockers, and a proton pump inhibitor. An upper GI endoscopy done earlier in the year showed mild gastritis, and testing was positive for H. pylori. He received triple antibiotic therapy, but without improved symptoms. An abdominal ultrasound and several blood studies were also negative. This visit was prompted by continued difficulties in carrying out work, and on several occasions, he had to leave the business meeting because of the pain. Hey, Mr. Stetson, I'm Dr. Drossman. How can I help you?
Yeah, okay, thank you.
Well, what are you here for?
Well, I had an endoscopy some time ago, and they looked around in there, and I think they called it gastritis or something, and they gave me some medicine for that and everything. But
Okay.
but I'm just having a lot of pain.
Yeah, what kind of medicine did they give you?
H blocker and maybe some antibiotics or something too. But I've been taking that medicine and a lot of stuff for heartburn too. I mean, well, antacids and everything, because it feels like heartburn. I know it's here. It's in my abdomen.
Okay. So the workup was negative and nothing was found.
Yeah, pretty much.
Okay. And then why are you here again?
Because I need some pain medicine that's going to allow me to do my work and concentrate and be efficient at work.
What do you do? What kind of work
Well,
do you do?
I'm an executive in a large corporation, and I really need to stay sharp.
Okay. And you're not feeling sharp now, is that?
No, the pain is. Sometimes it keeps me up at night. I don't get a good night's sleep, and yeah, and we had a meeting about 2 weeks ago, and I actually had to leave the meeting because I was in so much pain.
Well, it sounds like stress to me. I imagine it's been a stressful environment for you.
Well, yeah, but I mean, I love the job, and I really want to, stay there and keep on working there.
Yeah, well, see, the thing is, the workup has been negative, and you've been on acid blockers, and that's not any better.
Yeah,
It sounds like they treated what sounded like H. pylori, at least from the records.
yeah.
And so I'm not sure what else can I do? I mean, you've been to a doctor already.
Yeah. Well, I just figured you could give me something that for the pain that would, just
Well,
make
we don't
it so.
give narcotics, if that's what you're looking for.
I did. I'm not asking for narcotics. I don't want to be doped up at work. I just want something that's not going to just relieve the pain.
Okay, well, I mean, we can do that. I mean, I can give you some pain medication. I also wonder have you ever thought about seeing a psychologist to try to talk about this? Because stress can sometimes make pain worse. And look, you're getting older. It's really a time that maybe you need to think about what you can do to make your life a little bit better.
My job is my life, and I don't want to retire. I'm not interested in that. I want to stay in this firm as long as I can. And if I can keep my work regimen up to par, I have a chance to stay with them until I'm 70 years old. I'm not that old. I'm not ready to quit.
Well, with all due respect, Mr. Stetson, I mean, I'm here to help you, and I can give you some advice, and that might be that, you don't have cancer, you don't have ulcers, the workup is negative, this is going to be stress. You're getting older, and it's time to settle down. But if you don't want to see a psychologist, well, I'll go ahead and give you a prescription. We'll do a physical exam now, and feel free to come back if you have any more problems.
All right.
All right, I'll let you get into it again.
Okay.
You think he's going to come back?
Not by the look on his face there.
Tell me a little bit about what you saw here.
That was a pretty bad interaction there. I think, obviously you appear to be rushed. You're looking at your watch. You're dismissive as soon as you look at the chart and see that all of the testing is negative, and you immediately attribute his symptoms to stress, which we know stress can play a role in symptom presentation and severity, but probably other things are at play here, and you don't really take the time to dig in and see what else is going on. Because you're distracted, as he's trying to talk to you a little bit about the impact of this on his job performance, you don't necessarily hear from him how important his job is to him and how important his performance is, and how he's really feeling a lot of, maybe anxiety around his decreased performance. And so that is really tricky then later on in the process, when you recommend that maybe he consider retirement and insinuate that he's older and it's time that he start thinking about a different life. And had you taken the time to listen earlier on in the conversation, you would have picked up on the fact that his job is so important to him and his whole world. And maybe that situation, that interaction would have been a little bit different, because as soon as you say that to him, he immediately shuts down. And then any recommendation that you have for treatment is not going to be very well received. And then additionally, you assume that he's drug seeking. You say, well, we don't give opioids. And I think that was also a bit dismissive and really upset him. You could see the look on his face was, well, I'm not asking for opioids, So all in all, I think not a very good interaction. I don't think that he will be following up with you. If he needs anything, he'll be seeking someone else.
Yeah, and this doctor, his head was not there. He was just looking. He was acting by reflex. Can't find anything. Must be stress. But the real element is stress obviously can play a role. But he wasn't looking for the elements of what's stressful, or he wasn't recognizing the signals he was doing, because if he did recognize the signals, and was able to articulate that the way the patient does, then they're working together towards some solutions.
Yeah, and I think it was a good recommendation that he consider, you know, stress reduction and possibly working with a psychologist, but you didn't make the rationale for why.
It was
So
done in a dismissive manner, wasn't it?
exactly.
Okay, so you think we can improve upon this?
Lord, I hope so.
Mr. Stetson,
Yes,
Hey,
yes, sir.
I'm
Hi,
Dr.
Mr.
Drossman.
Dr. Drossman, hi, nice to meet you.
How can I help you?
Well, I've got some concerns about my current health situation. It's beginning to affect my work a bit, and I'm hoping that there's some medicine that I can get that will allow me to, you know, continue my career.
Sure.
I'm a top executive with this company, and you know, and I just would like to stay sharp and be able to be on top of things.
All right, so I hear that what you've got is affecting your work.
I had some pain a week or so ago, and actually it was so bad I had to leave one of my meetings.
I think we'll get to see how it's affecting your work. Tell me a little bit more about the symptoms. What are they exactly?
Well, I mean, it feels like the burning sensation. I mean, it doesn't seem to make much difference whether what I've eaten.
Okay, and then I understand you've had some medical evaluation.
Yeah, I had an endoscopy, and they took a look around, and um, I forgot what they said. I mean, it you know, but they did prescribe some H2 blockers and some stuff like that.
Did that help?
Not really, no.
All
And
right.
you know, and the thing is like I really need to be on top of my game, you know, with my job. I think during the day I'm not quite as maybe mentally alert as I have been in the past, and you know, and I'm worried about that because I really need to stay on the top. You know, I need to stay on top of my game at work, you know. And
Well, how do you think your work performance is at this time?
well, I mean, it's not quite as good as it has been in the past, and you know, and I'm concerned that well, I'm concerned that maybe this is age related, and you know, and I really I want to stay on with the job, and there's a chance that I could be stay on. I'm 64 now, but I could stay on at 65. I could stay on a year at a time with evaluations up until age 70, and I really want to do that if at all possible.
Okay, so what I'm understanding is that the episodes of pain are interfering with work, and then you're also getting concerned about whether you can continue on at the
Yeah,
job.
yeah, absolutely, and you know, I mean, I can't. Well, like we used to go out to lunch sometimes and have, you know, drinks at lunch or whatever, but right now I just feel like, you know, sometimes I don't think I can really do that anymore. You know, I think it has more effect on me than it used to, and I don't recover as quickly, you know.
Have you had comments from individuals about how you're doing?
Uh, yeah, one of my closer colleagues was worried that I may be drinking too much, and I maybe I am. I mean, you know, it numbs the pain, so yeah, and you know that's a worry. I mean, I need something so that I can, you know, so I can just stay more alert and with it, you know.
I think I understand that now. And how is that affecting your mood?
Well, I mean, it really it's very upsetting to me because um, this is pretty much my life, and I feel like, well, if I don't have this job, then you know, I don't know what I'll do. You know,
Have you had thoughts of what I could do to be of help to you?
if you think that I should change some things about my lifestyle, and you have a suggestion of how that could happen, I'm open to that.
The one thing I'm hearing is that you may be drinking a little bit more too, and I heard you say that that's to help the pain,
Yeah.
but it may be to help other kinds of pains. We certainly can work on the pain in terms of treatment with medication,
Okay.
but over and above that, there are some very large issues you're dealing with. Can you continue at work?
Yeah, that's a
And
big one.
the drinking itself may become a problem if you're losing control of that, especially if other people are mentioning it to you.
Yeah, probably so.
Have you considered whether you'd want to go into an alcohol rehab program as an option?
At this point, I think I'm willing to do anything to keep my job. So yeah, I'll do that.
Okay. Well, why don't we do that? And I'm going to be putting you on medication. We're going to do a physical exam, but what I think we're coming to is getting you on a medication for the abdominal pain. We call that epigastric pain syndrome.
Mm-hmm.
That's a technical term for what we call functional dyspepsia, where you have this burning sensation.
Mm-hmm.
And because the acid blockers have not worked, I think what we're going to do is put you on what we call a neuromodulator, which in the old term was antidepressant,
Oh, okay.
because it works on the pain. But in addition to that, I think it might help in terms of where you are right now, how you're feeling. You may be feeling a sense that there's no way out, and this can help you clear your mind a little bit.
Yeah. Yeah, I never really thought about it as depression, but it's worried me a lot. So maybe something like that would be a lot of help.
All right, well, I'm prepared to work with you on this. We'll see you back in about a month. We'll do the physical exam. We'll get you started on the medication, and then I think you would have to initiate the alcohol rehab program yourself. I can give you some leads,
Okay.
but of course, it has to come from you. And I understand it might be challenging to do it.
Yeah.
We also may have the option, if that hasn't happened the next time, is to have you see one of the counselors, psychologists, to help you work through this, and then maybe you'd be interested in working on that further.
Okay. Sounds like a plan.
All right, well, why don't you get into a gown, and we'll examine you shortly.
Okay.
Is this any different?
This was a much different interaction and clearly more satisfactory to both parties, I would think. I mean, right off the bat, you come in and your engagement with him is completely different. Even the way that you're facing him, your body language, it's very, your body is even turned a little bit more towards him. You're looking at him the entire time. You're providing affirmative nods and gestures as he's talking, which encourages him to keep going. I just think the whole beginning of your relationship with him was a much different situation than the last one. You asked about his performance. You said, so tell me about, how do you feel your performance is? And that really provided this bridge that allowed him to be more comfortable in disclosing some pretty personal information about his own fears and anxieties, which then you were able to build upon and make some recommendations for him. And the other key thing that I noticed in this section, Dr. Drossman, is that you provided a diagnosis. The first interview had no diagnosis and really no treatment plan. I mean, you said, yeah, well, I can give you something for the pain, but in this one, you really talked about what that would entail and the use of a neuromodulator and how it would work. And the co-benefit of possibly treating some underlying depression issues as well, which was really key for him to be able to understand and feel confident in this interaction. And then, of course, the last one, you didn't have any follow-up plan. You didn't say, I'd like to work with you at all. You said, call me if you need me. And this one, you said, I'm prepared to work with you. We'll follow up in a certain amount of time and we'll go from there, which really set that expectation that you're going to be a partner long-term.
Yes, all of those points I completely agree with. This was a biopsychosocial interview, And I'm saying that you're integrating both the biologic and the psychosocial, because if you have dualistic thinking, if you think about this in a dualistic way, one approach could say, well, the first interview, he needed to rely on the blood tests and the studies to make a diagnosis. And then if there's something psychologic, well, that's the psychologist. But
Right.
here, he's integrating the information. And as you pointed out, he was looking at the medical information as well as the psychosocial in the context of the same number of 5 minutes.
Right.
So he identified that the PPIs were not helpful. The location, this was epigastric pain syndrome. That would open the door to the use of neuromodulators since the PPIs didn't work. And then he also allowed the patient to articulate by letting him do it, patient-centered way, to expand upon his thoughts and feelings. And you can see this is not someone who comes in defensive. He's very open to
Right.
what the doctor has to say, which is very different from the first interview.
Absolutely. And it was all in your approach. And I think he really felt comfortable. And I think it was clear that because he was feeling comfortable and really feeling that empathy and that understanding from you, he was willing to disclose that personal information.
Okay. Well, why don't we take a look for just a couple of more minutes. What I did here is interview Mr. Stetson, who's Davis, who's Stilson, who's our videographer, who I've worked with for over 40 years. And he's also, as you can see, quite a good actor. So what I'm going to do is ask him now to be in role and speak about his perspective on the two interviews.
Well, Ms. Stetson, I'd like to know a little bit more about how those interviews went for you.
Mm-hmm.
Let's talk about the first one. What was that like?
Well, it was, I didn't feel particularly good about it. I mean, it was kind of irritating to get right down to it because, you know, I'm 64 years old and the doctor just kept asking me like, well, you're old, you know, what do you expect? I mean, that's not, I didn't like that at all. And you know, finally he agreed to give me some pain medicine, but I have no idea that it was going to help, you know.
Do you think you got to all the problems in terms of where you were?
Well, no, it just really upset me more than anything else because, you know, I've been at the top of my career for many, many years, and I've got a chance to stay until I'm 70. And this job is my life. I really don't want to retire. So when he kept saying, well, it's stress-related this and stress-related that, and maybe you should think about quitting and retiring because you're 64, I'm like, no. Boy, that didn't help me at all.
All right, well, how was the second one compared to the first?
Well, it was much better in the sense that I just felt like I was talking to somebody who really cared about me or was interested. Because the other guy was flipping through papers a couple of times and looking at his computer some too. Yeah, and you know, I actually told him that I was concerned and about my drinking issues, and agreed to, you know, to possibly going to AA or getting some counseling for that.
Which is not something you would have done with anyone?
I didn't expect to even talk about it. It just I just kind of opened up, you know.
Is there anything else he did that was helpful to you?
I think that he also said, you know, that there are some antidepressants that can be used to help treat my condition, and along with maybe some pain medication. And because I hadn't even thought about being depressed, but when he said that, and I thought, well, actually I have been kind of depressed because, you know, that's when I admitted I'd been drinking a lot, or maybe more than I should. So
Okay.
yeah, it was
Well,
good.
thank you.
Yeah.
You know, one of the features of a patient-centered, open-ended interview is that sometimes you don't know what is going to come out, and neither does the patient. Because what you're doing is you're creating the opportunity for them to reflect. psychologically, it's pre-conscious thinking. It's almost ready to come out, but they're not aware of it. And when they're given the environment to talk, they work that out and they bring it up. And then it's very meaningful for the patient and the doctor to have that information, because now you have something to work with that previously was not even understood, but could be the basis for improvement.
Absolutely. 100% agree.
Okay. Well, so this is what the advanced training is. We have this available. I think patients might enjoy this too, but certainly for physicians, it's a way to learn good communication skills.
Absolutely. And this series, along with the 101 and the 101.5 series, are all available on the romefoundation.org website. romeonline.org is the store address. You can go there and find all of these and more, including our book, Gut Feelings, which summarizes a lot of this information too. Right there behind me and right there. So if you have any questions for Dr. Drossman about this or any other topics related to good communication skills with patients and doctors, please send us a note. We'd be happy to get back to you. Until next time, have a great rest of your week. Stay safe and we'll see you soon. Bye now.
I know.